Thank you for joining us today. Just a reminder, this is responding to our community's mental health challenges, a role for volunteering. Previously sent to you in the confirming document from yesterday or today. You should have a meeting agenda, the bio information about all the speakers, a handout of suggested articles, books, and other links, um, and data on mental health and volunteering, as well as information on some upcoming webinars. So why don't we go ahead and get started? Thank you so much for joining us. We're very excited to have you be here today. Just a reminder that we are recording this session. I am Susan Sano. I'm the senior manager for volunteer management education here at Volunteer Fairfax, and this is the beginning of our observation of our Martin Luther King Jr. Week of Service. This is our fifth annual community conversation. This is a program that we started in 2020, 2021, and it's to bring the community together to address issues that are facing our community, as well as some of the issues Dr. King was committed to during his lifetime. Um, I can tell you in 2020, I asked the question, what can volunteer managers do about racism? And we've been discussing that ever since, and we continue to have that discussion. In 2025, I started asking this question now of what can volunteer managers do about good community mental health? And that's how we got to this point today. We know that we couldn't host free community events without generous support from our sponsors. For this week of service, our presenting sponsor for the second year in a row is ITC Federal. We have a gold sponsor, Amazon, silver sponsors, Virginia Hart and AT&T. We also have several bronze sponsors, including Leidos, Deltec, Northwest Federal Credit Union, and Freedom Bank. Additionally, we're grateful for the support for our in-kind sponsors, Reworld, Wegmans, Giant Food, Commonwealth Brewing, Interstate, and the Fairfax County Department of Family Services. Finally, we want to recognize our two grantors in this event, the Youth Service America and Serve Virginia. Thank you all to your amazing sponsorship and support. It makes these events possible and accessible. Um, we do want our presenting sponsor to say a few words of welcome. Chris Watkins, who is their Vice President for Proposal Development and a good friend of our organization, if you'd like to say a few words. Chris?
No problem. Thank you, Susan. Good afternoon, everyone. On behalf of our CEO, Greg Fitzgerald, and the teams at ITC Federal, we are truly honored to join you as a presenting sponsor of today's MLK Community Conversation focusing on mental health. A special thank you to Volunteer Fairfax for the opportunity to participate in the MLK Junior Week of Service and creating this space for us to come together today to talk freely and openly about this critical issue facing our communities today. For those new to ITC, we are a technology service provider that delivers innovative IT solutions to the federal government. We are highly successful because of our leaders and teams who are supporting missions that affect us on a local level. And at ITC, we understand mental health is fundamental to a life well lived. From our personal lives to the workplace to our communities, mental health affects us all. And so as a company, we make sure that we provide health services for our team, whether it is one-on-one therapy, group sessions, self-guided resources, coaching support, and a work-life specialist that can assist with childcare and elder care. These services are important to us. And furthermore, as we are more and more with the events that help happen in California, we're in a world where families are affected by natural disasters annually. And so we have resources available for them as well when those circumstances arise. Our teams are able to access these mental health resources without our company ever being notified who accessed them. We only receive the metrics of showing participation in this program. And this is critically important to ITC to remove any stigma and ensure everyone has access to the help and services they need to support their well-being. And so this week, as I was thinking about King and how so often we separate him from his community or his humanity as a cultural, social, and political figure, I was just thinking about Martin Luther King Jr. simply as a son, a grandson, a brother, a husband, a father, and friend, and what he was to himself. And as I think about this humanity, I was reminded of historians who teach us that King attempted suicide twice before the age of 13 over deep grief of his friend and his grandmother. And furthermore, although never diagnosed, we know King suffered from bouts of depression as an adult, which is not hard to believe with truly knowing. We all know now that he had the weight of a movement on his shoulder, consistent death threats, the FBI watching him, and the safety of his family and himself to be consistently concerned with after the age of 26, which he begins the Montgomery bus boycott movement. But we do know that he reaches a type of freedom within his mind, a resolve, so to speak, that we only get to touch for a moment in his speech, I've been to the mountaintop. And so personally, I shudder to think who will we be as a community, a nation, and a world without the life of King. His life is still like a rock in a pond with ripple effects that cannot be numbered. And so today's community conversation is an opportunity for all of us to gain a better understanding of mental health and explore how we can better support one another as neighbors. This aligns with Dr. King's dream of creating a community where everyone can thrive without barriers to race, gender, care, or understanding. So, to all of you, thank you for allowing ITC to be part of what we know is a critical dialogue. We are proud to stand with you as a community partner responding to King's question, what are you doing for others? And we can all fulfill this question today and for the rest of our lives, for ourselves, our families, and our communities by asking one of the most powerful questions in the world. How are you today? Thank you, Susan, and let me give the conversation back over to you. I look forward to today. Thank you.
Thank you, Chris. Can I just say, very unexpected. I got chills two, maybe three times. I saw several of our panelists with a wow, and that's so proud to have you a part of this. And you've moved the conversation forward. So, yeah, I just got a text from somebody saying wow. So thank you so much. We want to remind people that we are venturing into some new areas. This is a brave space. We're respectful of our speakers and our participants and the point of view that we are truly always learning. Something may be said wrong. It can be done from me. It can be said by anybody. The idea is that we call people not out, but call people in, and we're trying to be better allies for each other in our community and our profession. Should something trigger, just take notice. We understand what something can be said. It's okay to take a step back. Ask yourself, why are you reacting this way? Finding your breath to find peace. What what is it trying to tell you, and how would you like to respond? Staying on camera is always welcome. Going off camera is fine. We are good with that, and figure out what you want to do going forward. We encourage questions to be asked to the speakers using that Q&A button at the bottom of your screen. Um, Questions will be sent directly to the speakers and our panelists. If you are asking in the chat area, that's a place where you can talk to each other. I am fine with people questioning, talking, giving answers, having that side conversation, the whispering, that all can be done through the chat area, and I welcome it because that's about truly being connected. I can tell you in the planning of this, we realized that the platform that we're using is one of the most disconnected for building community. And I want to sort of say, I apologize. I forgot about that, but I was looking at what's the most convenient way to bring as many people together in the middle of January when it's cold and snowy. That's me. So we've chosen to meet via Zoom, and but we want to encourage that connection as much as we can. As we prepared for this week, one of the things that just happened to come across my desk, the outgoing Surgeon General, Vivek Murthy, published my parting prescription for America. Just last week, I just stumbled on it. It's in the link is in your handout. You can Google it as well. It's really a rich statement of how we can best or better care for our community. I was really taken by this triad of fulfillment: relationship, service, and purpose. I think that's what we all work in volunteer management. But I was really taken by his quote, and I wanted to share that at a time when so many people feel like they don't matter, service reminds us we have value we bring to the world. Was he talking to volunteer managers? In my mind, he certainly was. I want to make sure that we're all on the same page and we can agree that yes, there are benefits to your mental health benefits to serve you receive when volunteering. We have that increased uh, interpersonal connection. We have a greater sense of purpose. You wake up in the morning and you have something that can be impactful to somebody else. It reduces stress, sharpens mental acuity, increases self-confidence. I love this helper's high to elevate your mood. It lowers rates of depression. And sometimes it's just a distraction of maybe your own personal challenges. It breaks up the monotony of whatever you think you're going through and is taking you down, and can say, you know what, instead of being sad, I'm going to go and help you today. There's a lot of different ways we can look at how volunteering and mental health, how they're linked. We're choosing today to look at it by age. Um, Kids, to open up their world and realize there's something beyond their own house, that it builds community, some healthy habits, learn diverse perspectives. Um, if those teen years, can they be turbulent? Usually there's some bumpiness that's going to occur, but what if they see others with those challenges and needs? They can meet new people, learn from mentors. They talk about building skill for college and getting into college or beginning their careers. I think that's just skills for life. Uh, those adults' responsibilities really can keep us busy and can, drag us down. But um, by volunteering, it can break that chain and realize they need to stay also connected to issues or causes, and it can be something greater than themselves, as well as being role models for those teens and children. And then our seniors, those are the ones that have the greatest risk of social isolation, because sometimes their isolation is not always by choice, but staying connected through volunteering, it can actually slow some of these changes, depression and um, physical decline, and it keeps them connected. It gives them a social life, helps them with a sense of purpose and connection. So with that, now that we have that base information, I'm really so honored to introduce Rebecca Kiesling, who is the Executive Director for the National Alliance on Mental Illness, the Northern Virginia chapter. Um, she will give some introductory remarks about the status of mental health in our community, but I can tell you in the planning of the session, my number one choice, the person I wanted to have us have host today more than anyone was Rebecca. So I do want to thank her from the very start by making my dream come true and have you guide us through the rest of the program today. So, Rebecca.
Well, thank you very much. What an introduction. Nothing to live up to there. That and headshots. Those are two, I think, bios and headshots. You have a lot to live up to. But also, Susan, thank you for your remarks on the importance of volunteering. And Chris, thank you and ITC Federal. What a fantastic commitment to the mental health and mental wellness of your employees. It's stellar. And a lot of you will know we don't hear that a lot. Next slide, Susan. So we talk a lot about mental health, and we talked a lot of, Susan mentioned some of the ways that volunteering can help your mental health, but we also need to think about what your mental health affects. I know I can't see everybody's hand right now, but how many people have physical health? Everybody's hand should be going up, because think about that. We all have physical health. We go to doctors. I just got over the flu. How many people have mental health? The same number of hands should be going up because we all do. Having mental health doesn't mean that you have a diagnosed serious mental illness. It means that how you are doing impacts everything around you. So your physical health, milestones, your ability to learn, if people are showing up to work or school, interactions between in relationships. So your peers, your spouse, school members, all of these are intrinsically related to your mental health. There we go. So just a little bit. These are national. Oops, one back.
Oops, I told you this is okay. Thank you.
So these are some statistics we use at NAMI. NAMI is a National Alliance on Mental Illness, or a national organization. So we talk national first. When I first started in April of 2022, there were a couple of things on here that really struck me. And 2.5 years later, they still do. One of them is the suicide rates. Suicide rate, I always thought it was teens. Teens had the highest suicide rate, but that's not the truth. The highest suicide rate in our country is for men age 65 and older. Now, you can add on to that and go even further. Black men age 65 and older have the highest suicide rate in our country. But also, if you look on the other side of that, 50% of all lifetime mental illness begins by the age of 14. I have a 14-year-old, a 19-year-old, and a 22-year-old. And I know this to be true because one of my children has a serious mental illness, and we dealt with that with her. But 50%, that's a lot. That's a big number by the age of 14. Can you move forward, please? If we look for Northern Virginia specifically, 38% of our population here in Northern Virginia experience active symptoms of a mental health disorder, mental health concern, say what you want, and they want service. So these are people that know that they need some help. 11% of adults with a serious mental illness have no insurance coverage. Remember from the slide before, the number of homeless or unhoused is significantly related to people with mental illness. We see people going in and out of housing who have SMI, who are living at SSDI, which is a poverty level, who can't find housing, but also might not be able to hold a job. Susan? So how does physical health, ooh, one of my things is gone, physical health impact your mental health? That little bed right there, I bet you can guess. You need enough sleep. These are all things we've heard since, health in high school. Did anybody else have health in high school? I did. Eat healthy, exercise. But like Susan said, volunteering. Volunteering is such a great way to impact both your physical and your mental health. And Susan went over a lot of that before. Keep going. So just really quickly, NAMI Northern Virginia has been around for 47 years. We started in Old Town Alexandria, and now we support about 25% of the population of Virginia. So Arlington, Fairfax, Loudoun counties, and Alexandria, Fairfax, and Falls Church, and anybody in between. What we're known for nationally is that we provide no-cost education, support, advocacy, and public awareness. We're stigma breakers. We want people to understand that they do have physical and mental health, that you say, a young person saying that they are on an antidepressant, it's the same as somebody saying, I took it for all 7 days this week. We cheer for people who work out 7 days a week. We should cheer for people who are taking their medication 7 days a week. And that's one of the things that we try to do. We also have support groups for peers and family members, so people living with mental health concerns, and also the people that love and support them. Caregiving in our country for somebody with a mental illness is an average of 32 hours a week. And so we need to support those caregivers. We don't endorse a specific medical therapy, medications, treatment. That's not us. We've all been there. Everyone on our team here and our board is impacted in some way by a mental health concern, most likely a serious mental illness. I myself am both a peer and a family member. So just a little of what we do. We have a lot more programs, but these are our support groups and classes. So support groups, connection recovery support groups are for peers. Family support groups are for family members and loved ones. And then family to family and peer to peer are both 8-session courses designed to not only understand mental health concerns, but also to understand recovery and how to get there or stay there. And then we have a number of other programs after that. But really, you didn't come here to learn about NAMI or me. What we're here to do is talk about mental health and volunteering and how we all how everyone is living together and working towards the same goals in terms of being impactful in terms of mental health with a whole bunch of different ways. You can find a bio in your packet for each of your speakers here. But, we're going to start a little bit we're going to start with the numbers. Chloe Lee is PhD. She's a data scientist and youth survey program manager at the Department of Management and Budget for Fairfax County. She's going to share her findings and the trends from our annual Fairfax County Annual Youth Survey.
All right, thank you very much for the introduction, Rebecca, and good afternoon, everyone. Thank you for joining us today again. I'll be sharing some of the most recent youth survey data on mental health, community service, and volunteering to provide some background for our discussions today. Next slide, please. Okay, let's start with mental health. So in 2023, about 1 in 5, 8, 10, and 12 graders in Fairfax County reported feeling stressed all or most of the time in the past month. 1 in 4 reported feeling sad or hopeless every day for 2 or more weeks in the past year. 9% reported having considered suicide, while 3% reported attempting suicide in the past year. Although 3% might sound low, can you go back to the slide? Yep, sorry. It still represents over 700 students among the survey participants alone. Okay, next slide, please. However, here's the good news. This year's data show continued improvement in the students' mental health since 2021, when mental health concerns peaked during the COVID-19 pandemic, as represented by the yellow vertical line on the slide. Can we go back? I'm sorry. In 2021, 38% of the students reported feeling sad or hopeless, 17% reported suicidal ideations, and 6% reported suicide attempts in the past year. And as you can see in the graphs, these rates continue to decrease over the past 2 years. Let's go to the next slide. Despite the good news, mental health concerns were reported differently across different demographic groups. For example, non-binary students and those who identify as other gender reported significantly higher rates of mental health concerns, such as feeling sad or hopeless, than male or female students. The rates for female students are also significantly higher than male students. In terms of race and ethnicity, Hispanic students and students of other races were most likely to report feeling sad or hopeless in the past year. LGBTQ students and students from food insecure homes also reported higher rates of mental health concerns than their peers. The take-home message here is that mental health outcomes are not the same for everyone. There are multiple layers of disparities deeply woven into the issue. Okay, let's go to the next slide. That was also the case for community service or volunteering. So overall, 55% of Fairfax County 8th, 10th, and 12th graders reported participating in community service in the past year. However, those rates differ significantly across various demographic groups. For example, only 37% of students from food insecure homes reported volunteering in the past year, compared to 56% of the students from food secure homes. Race and ethnicity also matter. Hispanic and Black students reported significantly lower rates of volunteering than their peers. Similarly, students who speak a language other than English at home also showed lower rates in general, especially among Spanish-speaking students. Only 27% of the students from Spanish-speaking households reported volunteering in the past year, compared to 60% of the students from English-speaking homes, 72% of students from Chinese-speaking households, and 75% of the students from Korean-speaking households. So this data suggests that we need an equity lens to examine who can volunteer, who has access to these activities, and what individualized experiences are like for different groups of youth. Let's go to the next slide. We sometimes assume that the students may not have the time to volunteer due to other responsibilities and activities. However, the data suggests otherwise. So students who reported volunteering in the past year also indicated higher rates of participation in extracurricular activities, spending more time on homework, engaging in physical activities, and participating in religious activities. It's not on the slide here, but they also tend to work more, so work as in a job. On the other hand, they spend significantly less time on screen compared to their non-volunteering peers. This suggests that students who volunteer are likely finding ways to balance their time effectively despite their busy schedules. On the other hand, though, non-volunteering students may lack resources, access, or guidance to participating in such activities, including volunteering. Let's go to the next slide. So the survey suggests possible associations between volunteering and mental health. That is, students who report volunteering are also less likely to report mental health concerns. I'm a data person, so I'm going to be really precise, but we cannot really draw causal inferences between these two because this is a point-in-time survey data, meaning that we can't really say good volunteering experience can cause good mental health. However, there may be an association between a sense of community engagement and improved mental health. And some of you, let's go to the next slide. Some of you might be familiar with the term protective factors. So protective factors are attributes that help youth mitigate risk, build resiliency, and make healthy choices. And volunteering can serve as a social space for cultivating these protective factors both internally and in the community context. In particular, I'd like to highlight that these interactions youth have with their peers, adults, and the people they serve through volunteering could act as a protective factor in their lives. The essence of protective factors is a meaningful relationships with trusted adults, which can help youth develop the strength to say no to harmful behaviors and embrace healthier lifestyles, which can potentially improve their mental health. I'll conclude by reiterating this message. We all recognize the benefit of volunteering. However, the data suggests that we have to address equity issues in access to these opportunities. To ensure all students benefit, we need to create more inclusive and accessible volunteering programs by developing flexible options and increasing outreach in underserved areas and to underserved populations. And this will help ensure more students can experience the positive mental health impacts of volunteering. Thank you very much.
Thank you, Chloe. Um, I don't know about everyone else. I wrote down the equity lens and for volunteering. Um, we're volunteer led. All of our programs are run by volunteers, so that means a lot. I need to make sure that we're good. We're good on that. That's what we're looking for too. Now I'm going to go to Laura Tiemann. Laura is our Senior Manager of Student Attendance and Engagement. So perfect follow on to Chloe for Fairfax County Public Schools. She's going to talk about how to build protective factors to forge a community connection for a healthier student population. So Laura, I'm going to turn it over to you.
Oh, good afternoon. You can hear me okay? Oh, wonderful. So it's great to be here with all of you today and just an invitation to extend compassion to yourself, to one another today as we move forward in this conversation. And Susan, I too had goosebumps a number of times today. I want to thank you, Chloe, for showing us some of that really important data and also being so mindful of the lives that we're talking about. Our youth, um, people in our communities, could be ourselves, people, that shared experience that we have. So I currently serve in Fairfax County Public Schools. I'm a mental health clinician and I'm in social work services. And my role is to support the policy and regulations that have to do with attendance and engagement. And when we think about protective factors, um, when our children and youth have three or more protective factors in their lives, they're more likely to manage stress, make better choices, and develop healthy habits. And one of the things I didn't realize before I worked in the schools is that school itself is one of the most significant protective factors for our youth, right? So, also during times of uncertainty, and really at any time, as humans, it's very stabilizing to have routines and predictability, right? During times of uncertainty, it's very stabilizing to know what comes next. And so when I think of some of the protective factors I wanted to highlight are having community adults to talk to, performing community service, participating in extracurricular activities, having teachers recognize good work, having parents available for help. One thing I wanted to share is that the pandemic disrupted family and students' relationships with school. Some of our students, we can't make assumptions, some students thrived, right, in remote learning. Some students really struggled. And what we know is that twice as many students nationally were not coming to school. After the pandemic, especially, we saw a lot of students um, struggling with mental health concerns in families in getting reconnected to the school environment. And so, one of the things I wanted to bring to your attention is through that equity lens, we know that attendance struggles are a leading cause of educational inequity. And some groups of students are at much higher risk of not feeling connected to school. And we know that mental health is one of the main drivers of not feeling connected to school. So school avoidance, you might have heard the term school refusal in the past where youth are not coming to school. The term school avoidance does not have that judgment, right, attached to it. When we think of school refusal, we think of like, I'm not going. Well, that doesn't honor the story of what's happening behind the scenes, right? So, one of the things I wanted to highlight today is the power of showing up in very ordinary day to day ways. So, one of the principles, we have 200 schools, we have 180,000 students. We're the 10th largest division in the United States. And that's very humbling because we're such a large, school family. One of the principals in a very large high school, um, he regularly stands out and welcomes every student as they come in to school. Fast forward, it was back to school night. One of the moms came up to him and said, I just want to thank you for greeting my daughter every day. And he thought, that's really not a big deal. And she said, no, no, you don't understand. She's never felt visible at school before until this year. When you stand out there and you welcome her by name, that changes her day. And then she said, where were you this morning? Because he had a meeting off site, right? And so he had to say, I'm sorry, I wasn't there. The power of the welcome, the predictable, warm welcome, the smile, hope filled greetings are transformative. And we know that when stress levels are high, the nervous system can get very activated. And I'm so grateful, Rebecca, for your kindness in explaining to us that we hold our physical health and our mental health and all the levels of awareness and really tuning into what that means. Earlier in my career, I thought, well, the way we support mental health is always through a provider, a mental health provider. And as a provider myself, I think that's amazing and wonderful. Many people don't have access to a mental health provider or they're on a wait list. But what I didn't realize was the power of the community connections. So if you have two neighbors that can count on you or you can count on them, your health and well being goes up throughout the lifespan. And a number of years ago, during COVID, my husband was undergoing chemotherapy. It was a very difficult time. I'm a person who has received treatment for anxiety over the course of my life. So my anxiety was very high. I had a woman call, I barely knew her from one of the kids' school. She said, Laura, so this is Stephanie. I'm like, who's Stephanie? She's, I didn't even know. She said, so this is Stephanie, and I'm asking which day this week you would like me to bring dinner. So up until that point, people had been, can I help? What can I do? Right? Wonderful. That's what I would do. How can I help your family during this time? No, she said, which day do you want me to come, Tuesday or Wednesday? Well, so that affected my mental health, my sense of hope, my sense of being connected. Who is this? Oh, hi, Steph. Nice to meet you. Right. So I give those examples because um, we sometimes underestimate the power of the day-to-day communication and opportunities that we have in our just our walks in our walks of life. So I talked about the two neighbors. One thing that's very powerful, and I'll illustrate with this story. There's a fifth grader struggling with attendance, a lot of attendance struggles, and we know that sometimes things are going on in the family that are very difficult, right? So a principal had an idea. Well, I'm going to ask her to be a patrol. And the other staff were like, why would you ask her to be a patrol? She never comes. She's not going to be there. Well, turns out she knew the student well enough to know that yes, the student was going to come every single day. The student loved having a job. She loved having that role in her school. And guess what? She came every day. And when she was sick, she called the principal. I know you need me. I can't come today because I'm sick, but I'm going to be there tomorrow. Transformative, right? Because someone saw her gifts and talents she didn't see. She didn't know she had that in her potentially. Perhaps no one in her life had seen that strength. So that principal pointed it out. And what I wanted to offer is that in volunteering, there's so many opportunities to recognize your own gifts and the gifts of those around you. And I was really moved, Chloe, that our in food and when in the areas where there's food insecurity, our youth have less opportunities to be able to experience perhaps community service opportunities to discover their gifts and talents, which really makes my heart sad and also leaves me with a challenge in terms of my work and the lens of how do we build school, community, and family partnerships. So I did want to say a little bit about mentoring in the school community. Mentoring is one of the most evidence-based um, ways to impact our youth. Having a trusted adult, one trusted adult. We can't assume how um, youth or adults, or any of us for that matter, move through a very difficult time. We all handle it in different ways depending on risk or protective factors that we have. But we know that mentoring and connection to one trusted adult is very powerful. So we have in Fairfax County Public Schools, we have a mentoring program where caring adults volunteer to provide one on one support and guidance. We also have business partnerships and community partnerships and memorandums of agreement that allow businesses and to serve as people to come in and serve as mentors. And boy, is that a win win, right? Because during times where your own life stresses are going on, to come outside yourself and to really have that reciprocity. How am I doing on time? I get carried away. Is it 6 minutes? I've got like 1 minute. I have 1 minute left. How many more minutes do I have? Two? Maybe two?
About a minute.
Perfect. All right. Thank you so much. So I wanted to talk a little bit about a story I was working with in my 20s. I was working with a reading program, and I had never been a reading tutor before. So I was working with a gentleman who really wanted to learn to read. This is in East Baltimore. And so we met weekly, and I learned just a tremendous amount from him. And he was working hard at learning English and explained to me a lot of his own story. Well, fast forward, I was not able to volunteer beyond a certain point, and I had to communicate it to him in some way, and I didn't know how I was going to do it. So what I decided to do is to get to our room early and write on the board my story of it's been so wonderful working with you. I unfortunately am not going to be able to continue volunteering, but so anyway, so I wrote a little letter on the board. So he read it, and he was so joyful that he could read it that he really wasn't that disappointed, but I could no longer work with him. And what I was touched by is how volunteering really touched my heart and over the years has made such a difference for me. Um, and uh, I wanted to just honor and thank all of you for being here today and for sharing yourselves in this beautiful space. So thank you.
Thank you so much, Laura. I don't know about one of the hard parts for me about being a panelist is I don't have the clapping emoji, or I don't have any of those responses, and I keep looking for it. I'm very grateful grateful to Susan for how she put together the speakers list, because they all are flowing right into each other. I think I'm a mom of three, I said, and all of my girls, I have a 14-year-old still in high school, and then two that have graduated. And uh, the group that Mo Meadows is representing, I think is one of the most impactful that we have in FCPS. So I am thankful. Mo is the school-based program manager for Our Minds Matter. And they're going to spotlight their program that encourages student volunteers to become mental health advocates.
Thank you, Rebecca. And hi, everyone. So nice to see you all here. I'm really honored to be here and excited because I was also just thinking about how my slides and my presentation kind of flows right into the things that Laura was saying and even the things that Chloe was saying. So just very excited to be here. I think I'll give Susan a moment to bring up the slide.
I'm
No worries.
Why Susan's doing that, keep using the Q&A and drop your questions in, and we'll either answer them live, or I'm going to feed them to our panelists so that they can answer, and we'll get back to you on the Q&A.
There we go. Thank you, Susan. All right, yeah. So I am Morgan Meadows, or Mo Meadows. I'm from Our Minds Matter. I'm the school-based program manager. We are a local nonprofit with a very ambitious goal. We are ultimately working towards a day where no teen dies by suicide. Our organization is a very localized mission. The Anderson family lost their son, Joshua Anderson, to suicide many years ago, I think going on 12 or 13 now, but he was a student in Fairfax County. He went to Langley High School, and I am just in awe at how this family was really able to transmute their grief into something positive. They really needed something to do with the emotions that they were feeling. And so they started the Joshua Anderson Foundation in 2012 to bring mental health supports into the Fairfax County school system. And so originally, what this looked like were these one-off speaking engagements. There were therapy dogs that were brought to a bunch of different schools, things like that. But there really became a need to go deeper, not just in terms of the organization and wanting to expand in the local DMV area, but also for the students that were being impacted by this program. Lauren and her family were finding that the students really wanted to keep building on these skills that they were gaining from learning at these different engagements and at these different conferences, and really wanting to strengthen their own personal toolkit in terms of being a mental health advocate. And so in 2016, the first 5 clubs were started in Fairfax County high schools. And since then, we have begun to spread our wings in the DMV area. We have partnerships with DC Public Schools, DC Charter Schools, and Montgomery County Public Schools as well. But we have our roots here in Fairfax County, obviously as our first school district and where the founding family is from. We love representing and being a part of this area. Next slide. Yeah, so our vision is ultimately working towards a day where no teen dies by suicide. This is where those protective factors that Laura and Chloe were talking about earlier, where we acknowledge that we're only one piece of the puzzle. Okay, we are a small but mighty team. You know, we are not practitioners, we are not clinicians, but we understand the role of community when it comes to talking about holistic wellness. And so the point of our Minds Matter and the program is really to equip young people with the mental health skills, training, and resources to be mental health advocates for themselves and for their peers. We understand and know very well the strain that our school clinicians are under with their capacity and their workloads. And so this program, because it is peer-to-peer, is meant to alleviate some of that burden and pressure off of the adults who are already on the ground working to support young people. So our program helps build 4 protective factors. You can go to the next slide. Proven to decrease the risk of teen suicide. These are from the JED Foundation's comprehensive approach to suicide. You can see where we've mapped out our protective factors from our program with the overall comprehensive approach to suicide prevention. So our program is focused on self-care and healthy habits. So encouraging young people to take care of themselves. Social connectedness, that is increasing belongingness in students and young people. We know that right now we are in a connection crisis, and that was highlighted at the top of the COVID-19 pandemic. So our program is really rooted in helping young people build in that connection and have that sense of belongingness before we even ask them to do anything else. Because if you're not connected with the people around you, how can we assume that you'll be able to show up in a good faith effort or with compassion or with kindness? The other protective factors from our program are pro-social skills. So that's the ability to offer help and support to another peer, and then help seeking, because ultimately, while we have our program and we encourage the peer-to-peer model, we do want to make sure that young people are turning to those clinicians, to those mental health staff who have the training to really support them if they have a true mental health crisis or challenge. Next slide. I'm sure I don't have to read this word for word or really ground us in the importance of suicide prevention in young people. Everyone has already touched on this. I mean, it is a youth mental health crisis right now, particularly. And so that's why we've seen our program be really important, because while obviously that tier 2, tier 3 support is really necessary and needed, when you have strong tier 1 supports in schools, it kind of lessens that burden that you have to have for those tier 2 and tier 3. Next slide. So how we work to ultimately change culture around mental health, because that is what we are aiming to do. So we utilize evidence-based strategies to help inform our programming. We have a teen advisory council made up of student leaders who help advise and consult us on our curriculum and our program to make sure that it's not just culturally relevant, but also teen informed. It's been a while since I've been in school, so I love having the young people check me on my slang and my language and my lingo, and all of those things are really necessary in order to make sure that our program stays relevant to the young people that we serve. And ultimately, what we're trying to do is empower young people in schools to be able to implement these holistic mental health initiatives that ultimately engage the entire school community to help build that network for young people. So whether it is another student leader in their school who they want to go to, or a mental health professional or a clinician or a psychologist or another trusted adult like a health teacher, ultimately we want to make sure that everyone in that community, i.e. the school, has that training and has the resources available to support their students. Next slide. So just a little bit of how it works, because some people ask. So a club is typically 3 to 5 engaged student leaders who host monthly meetings. They are facilitated also by a mental health staff in the school building. We recommend that someone, the adult supporting the club, obviously has some sort of mental health training, but we've also seen a lot of success with having a second trusted adult who maybe doesn't have as much of a caseload as a school psychologist, like an English teacher or a health teacher or someone else in the building. And so while students are having these monthly or weekly club meetings where the impact is really at that individual, more connection focused level, they also extend their work through school-wide campaigns, because obviously not every student is going to come to their school's mental health club meeting. So they throw school-wide campaigns to help engage the larger network and really starting to build on those organizing skills. Next slide. Yeah, so this is just a little bit of curriculum mapping with our protective factors. We know that with the capacity of school staff, it can be very limited, and we know that it may be unrealistic to say that a school has the capacity to support a full club. So we do offer signature campaigns as a way for school clinicians to engage their students in social emotional learning and other sort of means in terms of mental health advocacy. So these are prepackaged supply kits that we send out to schools with all the materials they need in order to host one of these 3 campaigns. And the last slides I have are more sort of data focused. Something that we found in our research and with our club model is that the more meetings that a student attends, the more socially connected they feel to not just their peers in the club, but also their school community, which ultimately predicts more higher scores in these protective factors that we're ultimately looking to increase in young people. Last slide. And yeah, so these are our outcomes. You can see that we've sort of parsed this out by dosage of students generally who take our impact form. So this is our entry poll and our exit poll. One is distributed in September, and then the other one's distributed in May. And this goes out to all students who are attending club meetings, whether they're a student leader or not. So you can see how with these outcomes around feeling socially connected, practicing self-care, seeking help, and supporting others, there's a lot of work still to be done, but for these students who are actively attending these club meetings and building a sense of community, they are reporting higher in these protective factors and ultimately decreasing the suicide ideation. And I think those were all my slides.
Mo, real quick, there was a question, and we
I saw the
normally
chat
wait for
kind of like blowing
and
up.
there's a few, but I want to address one live right now. How does Our Minds Matter utilize input from the youth survey in your prevention efforts, specifically as it relates to the 3 areas circled on the slide shared?
Yeah, so we definitely have looked through the youth survey data quite a bit. So how our partnerships actually work with the school districts, we meet with the school district's mental health team. So whether that's the student support services or the mental health and wellness department, to really understand the school district strategic goals in terms of what they are looking to increase. And so with Fairfax County in particular, something that came up in the youth survey data outside of the social connection bits that we already focus on were teens' engagement with drugs and alcohol and substance use in the obvious opioid epidemic. So something that we were able to do with Fairfax County was partner on a school-wide campaign called Be For Real that encourages safer partying, because we will assume that they're going to do it anyway. So how can they be safer and how can they have the resources? And so we were able to collaborate with the substance abuse specialists at each Fairfax County school so that they could house Narcan and fentanyl test strips that were available to students as a way to sort of utilize some of the data that we were seeing from the youth survey.
Thank you. What I appreciate, well, there's a lot of things I appreciate about Our Minds Matter, but they're real. You know, you can talk to the students that are going through the Our Minds Matter program, and it's real life. They're not sugarcoating it, but it is age appropriate, which as a parent and a mental health person, I think is very important, because the earlier we start, the better. Our last, but definitely not least, person on our panel is Stacy Iden. She's the director of RSVP Northern Virginia for Volunteer Fairfax, and she's going to share how senior volunteers age 55 and above get engaged and connected for good mental health.
Wonderful. Thank you, Rebecca, and good afternoon to everyone. And first off, thank you to Volunteer Fairfax, Susan, to our sponsors and everybody participating today. And I like being the last speaker or the last one, because you get to hear everything and hopefully can tie some of that together in some of my thoughts around what we're doing today. So thanks to all. This is an important topic. As Rebecca shared, I am Stacy Iden, and I do manage the AmeriCorps Retired and Senior Volunteer Program of Northern Virginia for Volunteer Fairfax, who is our host site. And I could spend time today sharing with you about that program for older adults and how that works, but it's a national program. Most kind of know a little bit about that. So I'm going to take a little bit of a different direction on that. In my role at Volunteer Fairfax, I certainly am able to work with volunteers, and there's a couple of them on our call today, and I support these older adult volunteers, 55 years of age and older, as they reflect on their life experiences. They take that and select kind of how, when, where they want to share the expertise that they have, and then eventually connect to opportunities that are in the Fairfax area, and be able to show the impact that they can have on their communities. And as I said, I'm appreciative kind of being the last. We've talked a lot about children and kind of moving through to older adults, but as a kind of a panelist and reflecting on my 35-year career and thinking about the comments that have happened today, I spent 10 years teaching public schools with children, so I'm understanding that lens. I also worked with children, youth and families and ministry. And then the last 15 years I've spent working with older adults, and those are adults that are beginning that journey into retirement, or those adults even at end of life. And there's a common thread that you see through all of this, and I've noted it from every speaker that has commented today, that really regardless of age, regardless of gender, race, ethnicity, of socioeconomic status, and that list can go on, that at every stage of life, we all long for connections and relationships with other people. And as human beings, we're social animals, and that kind of the tenor of one's social life is really one of the most important influences on mental health and physical health. Yet, there's a problem. And there's a disconnect right now, I think, in society between what we know we need with connection, and yet we see a disconnection. And it was referenced a little bit earlier, but I want to delve a little bit more deeply into it, that the Surgeon General has actually declared that there is a national loneliness and isolation epidemic throughout the country. And right now, that 1/2 of, or every 1 in 2 of US adults are experiencing considerable levels of loneliness, and the numbers are even higher actually among young people. And this loneliness that is being referenced, we all feel lonely sometimes when our experience some loneliness if we're away from our families for a period of time on a business trip. We come home, we reconnect, and we feel rejuvenated and reconnected after that. But this kind of loneliness that we're talking about, and the Surgeon General commented about it, is more of like a really deep hunger or a thirst. And it's a feeling that we have when something that is so important to our survival is missing from our lives. And so if we respond to it quickly, then we can work through that and things can improve. But if we don't respond to it, that's when we get into trouble. And that becomes worrisome for us, because loneliness is more than just a problem. It leads to depression. It leads to anxiety, which are both bad for our mental and our physical health. But we saw from a slide earlier that there is a solution. One of the solutions of many would be volunteering. And I would challenge that is, we talk about secret sauces sometimes that we have, it's important. And it is one of the best ways to combating isolation, because it provides avenues for connection. So we know that volunteering has significant benefits, and Susan shared a slide that listed all of those. You've got resources that you can go back to. And AmeriCorps actually did a survey of older adults and followed them for a 2-year period of time, and found that 84% had improved and or stable health, that 78% had fewer symptoms of depression, and 88% had decreased feelings of isolation. So we know that there are benefits to that. I think as volunteer managers, as I wear that hat of working with fellow CVAs that might be on the call, or those working in the volunteer management field, is that we have a responsibility, and that responsibility needs to be intentional. And I think that that's what this conversation is today. It's about us making a commitment as leaders to be bold, to be brave, to participate in conversations like this, where we're being exposed to data, we're being exposed to information about this. And then we need to understand that, and then we need to do something to act on it. It needs to become part of the story that we are telling, part of how we're promoting, and part of how we're sharing about the benefits of volunteering. It's not only the impact that it has on those receiving our services, but on the impact that it has on those of us who are giving. It poses challenges, though. And I'm not as concerned with folks like me, possibly. I fit into that 55 years of age and older, but I'm aware of the concern for the isolation, the loneliness, and I know the benefits that volunteering have. I serve as a volunteer at a local food pantry in my home area of Winchester. I do that on Tuesday evenings. And yes, I do that, one, selfishly, so that I can be at my best in understanding what volunteers go through, so that I can do my work better. But I also understand that I am working remotely most days of the week. I'm behind a computer. I'm not engaging with people as much as I should be. So I'm intentionally volunteering because I know that that's going to make a difference in my life. I have an older adult father who has dementia, Alzheimer's, and has for 5 or 6 years. I'm the primary care provider for him locally in my community. And so that takes me away from being able to be connected to other people. So the volunteering for me is a family. It's that connectedness that we're talking about. And then there's that added benefit of all the physical support that you get from, being physically active and moving and walking and loading boxes and all that happens there. So I think for people like me, it's just making sure that we're continuing to encourage them to continue to volunteer in ways that they are connected that way. And I don't have as much concern really for those adults in our program that come to us knowing that there is a concern. They come to us. We have what we call connection conversations with our new volunteers as they're coming on board, where again, we're talking, we're reflecting on their life, and we're beginning to select and connect them to opportunities. And most of the volunteers that we engage with, they're telling me that the reason they're connecting to RSVP and to volunteering is because they know that they are lacking social connections in their life. They're either single now and don't have others that live at home with them. They know that they're not getting out as much. They know that their connections to their church and neighbors might not be as strong. And so they see volunteering as an opportunity to build those social connections. And I often have the volunteers tell me that they don't want me to put them into positions where they're kind of stuck in an office or behind a desk. They want to be front and center in dealing with others and clients and all of the things that bring them that sense of connectedness and relationship. And I even, have some that tell me that they realize that they are not connected, and that's why they're connecting. I had a new volunteer just recently who used to give a number of hours to an organization here locally in the community, and that didn't work out for whatever reason. And after 10 years, she told me that she feels a void and doesn't have that in her life anymore, and that she's grieving. She's grieving the loss, and she needs to fill that void. So it's very, very, very real right now. So again, my concern for them is there, but we need to encourage them to connect. They've reached out. They know that they have a need. They know the benefits. But my real concern is what we were talking about earlier, and that's that equity, that access to volunteering. And that's the group that I'm more concerned about right now, is those persons who don't know, who don't have this information, don't know that volunteering can impact them, impact their mental and physical health. And so, we right now as a society are less inclined to get together for meals, for social engagements anymore. We've got social media right now and our online interactions that are taking us away from us. Technology takes us away from connections. We no longer have to go shopping and engage with the people at the store. We can just push a button and order online. We're not involved as much in our churches and ongoing organizations, recreational leagues. And the largest number right now of Americans living alone, it's more than 16 million, and it's larger than it's ever been. And so we know that volunteering is part of the solution. And so I come with it with an urgency, actually, that, if we know that loneliness is far more than just a bad feeling, and that it harms us individually and harms us as a society, we need to do something about that. And the Surgeon General also noted that the mortality impact of being socially disconnected is like that caused by smoking up to 15 cigarettes a day, and even greater than that associated with obesity and physical inactivity. So that's the call to action, I think, for all of us, to recognize this epidemic that we're dealing with and realizing it's across the board. It doesn't matter the age. It doesn't matter who we are. And so I think it's what will we do about that? And I'm going to leave you with one last thing from the Surgeon General. While I'm doing that, Susan, if you will pull up that last slide for me, there's often this picture or this stereotypical kind of thought in our mind, ageism, if you will, where older adults are walking around. Susan and I were talking about about this with canes in hands and not doing and not being engaged and active. This is a picture that represents some of our volunteers through our RSVP program, and you can see they are engaged. They are having fun. They are working hard to make a difference, to use their life skills and impact the communities that they are in. But the Surgeon General has an action that we've been called all to do, and it's called a 5 for 5 Connection Challenge. And it actually asks us for a course of 5 days in a row for us to reach out to somebody, to express gratitude to them, just to reach out to a friend or a neighbor or a colleague, to check on them, to offer some help to them, even to ask for help yourself from somebody that you know. And that doing this over 5 days will significantly impact you personally and make you feel differently about your own mental health. And so I would put that challenge in front of us. So thank you to all of those participating today, and I look forward to the continued conversation.
Thank you so much, Stacy. Real quick, I have a minute. Everybody take a deep breath. Let it out. Do it a couple of times. We just got a lot of information. And the fun part is going to be, the Q&A and interacting more. But this was a lot of information, and some of it might have been hard to hear if you weren't aware of some of the statistics. So just make sure you're treating yourself well. I know Susan started with that. I also so we had some themes, and none of us knew what each other's remarks were beforehand. I heard connection, equity, intentionality. What are some others? For the panels, come off mute. Say what you think, and if you have others for people attending, put it into the chat. What themes did you hear? I think a big one for me also was the hope, and I don't think anybody said that word, and that's one of my favorite, but there was hope in terms of being impactful. Involvement, mental and physical, being connected, collaboration, positive attitudes, making an impact, intention, commitment, understanding. These are great. Volunteer service and connectedness, connecting, being involved, community, good one. Protective factors, absolutely. Support, togetherness. These are great. And I think it was throughout everyone's presentation, I really think we all spoke about these themes in our own lens. So we do have some questions, and I'm going to start off with one and turn it back to why we're here in the first place. It's been 96 years since Dr. Martin Luther King Jr. was born, and 39 since we started celebrating his birthday as a national holiday. How are we addressing mental health needs in communities of color? Success stories. How about challenges as well? I'm going to pick on somebody. Mo, you're up.
Knew it was coming to me. Yeah, I think someone touched on this earlier. I think, Chris, even you mentioned this in your speech around the access to mental health supports and the access to resources. And I think something that we are consistently noticing in our program is it's not even low participation, but the low scores in protective factors from marginalized young people. And on the flip side, in a lot of these communities where the student population is predominantly marginalized, these are the same students that are also stepping up into leadership and leading these clubs, which I think says and speaks a lot about these communities. And I think particularly with Black young people, with Black youth, Black men, and the mental health crisis with young Black girls particularly, that's something that we are consistently trying to keep an eye on. I think something that we have consistently tried to do is proactively offer resources for our student leaders in these positions to foster more inclusive spaces as they're hosting club meetings. So, for example, in February, we do launch a Black Youth Minds Matter club guide for all of our student leaders. It has very specific resources. We just sort of did a revamp because I think a lot of assumptions were being made around Black people's understanding about mental health and the stigma that comes in our community, and needing to step back and say, before we offer the resources, do you understand what mental health is? Do you have an understanding of our relationship as Black people to the healthcare industry and how that shows up in how we receive care and also how we perceive care? So that's definitely something that we continuously think about. We also try to collaborate as much as we can with organizations who are doing the work of really focusing on marginalized communities. For example, we partnered in the past with the Coma Project, who is out of Arlington, Virginia. They do a lot of work with supporting the mental health of young Black women and girls. And so we try to partner with them. During Pride, we do LGBTQ Minds Matter, and we're had the privilege of being able to support the Pride Parade. So I think there's a lot of proactiveness that needs to happen before folks are at these like deep ends. Yeah.
First time I did it today. Oh,
I was gonna say you're on mute.
I was doing so well. Anybody else want to jump in on this? So we're talking about addressing the mental health needs in communities of color. For instance, with us, something we found important is to make sure that we are partnering with ambassadors. It's not me going in and being the expert. It's, we can train, we can provide the education and the technical assistance, but make sure that there's ambassadors of trusted people in communities. I think it's important. That's something that it's basically gospel for us, but it's been very helpful in terms of our outreach and education. Anybody else? So we talked about, we've gone from youth, we moved to adults. We have older adults. So how do you address good mental health intergenerationally? I'm going to pick on Laura to start, but I could get everybody on this.
Sure, I'm happy to start us off. One thing that really touched my heart in the last couple of years is I've had about 6 grandparents, extended family members, neighbors reach out to me saying, children in my life who I love are not coming to school. Help me. I'm worried for their future. I've explained my concern. Please can you help me? And one of the things I've noticed as a theme when I'm working with school teams, they'll, refer to resources, and we know sometimes a resource rich and maybe trust poor. We have to work on building trust over time. But oftentimes there's a family member we have not been in touch with yet. And that sometimes is a family member who has much more lived experience and for whom the family, there's a doorway there that's a natural, powerful support. And so I always say, who does this student or family look to for their, do they trust, do they turn to? Invite them in. Let's talk to them. We want their voices. They are experts to be valued and included and not on the outskirts, because we've got that big family system and we sometimes have a very narrow focus. So that's one piece when I think of that intergenerational gift of our intergenerational opportunities.
Stacy, Mo?
Yeah, I would like to respond to that from certainly thinking about older adult volunteers, and Laura kind of alluded to, that there are trusted persons who have lived life experience that they bring to the table. And I know through our program, AmeriCorps, because it's a national and federal grant that and a national program, is that we have to select kind of community needs that we see in the community that our older adult volunteers can have significant impact. And one of our focus areas, we call them focus or mission areas, is that education, that K through 12, and then that pre-K, also with school readiness. And what we find in that is that those adults who are able to serve as mentors or serve as a support system, classroom support system, that intergenerational, that both the child benefits from that lifelong experience and that relationship building, but that the older adult benefits greatly from that as well, because that's part of what they're missing in their lives in that. So we have, volunteers serving as mentors in the school system. We have them with Fairfax County in the kind of their parenting classes that meet in the evenings. There's tutoring that happens after school with some of our partner organizations that way. We even have some volunteers that help with, teaching aquatics and being in a relationship in a pool with children, and that has a significant impact. We also, our volunteers enjoy, Volunteer Fairfax has large events. There's a great big one coming up on Saturday in honor of Martin Luther King Jr. and this week of service, and they serve as support systems and participate alongside the youth in those events and in the projects that they're working on. And that has become a very popular way by which our volunteers like to give and stay connected. So I think just any types of relationship building that an older adult can do with any child or youth is an important one. So thank you.
Anything to add, Mo?
No, I think they named it all.
So I want to there were two questions that I think are similar, which is a really good question. Talking about transportation, we have a lot of talk about youth, but this is not just youth related. How do we get people involved if transportation is an issue? If there's a commitment that you have, we do for some of our programs, but people can't reliably show up. What about online volunteering? And what do we think of that? What kind of opportunities do we see as being available or that you offer? Who wants to jump?
I would be happy to jump from my experience with AmeriCorps, and the program that we have. Transportation is an issue. Transportation is an issue for the clients, obviously, that are receiving the services in the community, but transportation is an issue for some older adult volunteers. And that's where I go back to kind of, I'm not worried about me and those that are coming to us, because most of them have the means by which to get out to volunteer, but it is those persons we're talking about where the barriers are. That they can't get there. They don't have the financial means to be able to provide for whatever that they need to volunteer. So, what we through the partner organizations that we work with, there are opportunities for this online volunteering. And certainly during the pandemic, we were exposed to that. And it grew out of that. And AmeriCorps is even looking at that very closely as to how that can continue because there is that need so that these folks can be engaged without having to, especially in areas like ours where traffic is a difficult thing for them to experience. So that is certainly one way to do that. Also, I think our program is able to offer some mileage reimbursement to volunteers. And I think any program that might be able to find a resource or a donor that is able to help with that need. And we certainly have a number of our volunteers that tap into that benefit as well. So yes, transportation, it needs to be part of the creative thinking that we're doing to explore and break down the barriers to that.
Anybody else want to talk about Laura? I was wondering.
Yeah.
Yeah, great.
Yeah, I think being creative and thoughtful with those partnerships. We have a number of community centers in our area that are kind of in proximity to different transportation barriers. So when we think about, like, I've had people call me like, Laura, I see these vans sitting here and we got to move. How can we kind of connect the dots? Also, when I think about um, like a van associated with a community center, well, then now we have exposure to the community center. So then we are thinking like sustainable connections over time versus kind of coming and going and that's it. So trying to brainstorm around possibilities, some of which may not be feasible, but if we don't try, we won't be able to uncover something that could be a win-win. So transportation is certainly something that we're finding as a barrier for our students and families at points.
We're the same way. In the question, it was asked about social media. Absolutely. I mean, I think especially if you're looking at younger people, in terms of social media and being I don't know, my kids know Canva better than I do. Actually, our now consultant was Woodson High School grad, now in her second year at ODU, and she's doing our social media and our events. And she's doing it from afar, but she can do that because of how we structured it. And if you are looking to get more young volunteers, especially, think of those ways. Think of the ways that are specific to them, what they might be the best at. And it has definitely proven beneficial for us. I want to go to Chloe. The data. What's some population health data points that we should be watching? But also, we all are looking for metrics. How can you measure success? What would that look like?
Right, that's a really important question. So in terms of data availability, a lot of federal agencies provide a lot of the data, population data. So both the CDC and the Census Bureau publish a variety of population health data annually, and they often offer geographic and demographic breakdowns of the population at the county or the sub-county level even. So for example, CDC's Behavioral Risk Factor Surveillance System Survey, that's a long name, it asks respondents a series of questions about their physical health and mental health. And just a preview, according to the data, Fairfax County reported better mental health than the state and the national averages. However, the rates varied within the county, which is not really surprising. Some of the areas flagged with higher rates of mental health concerns include George Mason University area. A lot of young people are concentrated in the area, and also the Bailey's Crossroads. So you can see that mental health is definitely also a social demographic issue. The data clearly shows that. And our team also has published a couple of interesting in-depth report, both on youth mental health and the time use, including volunteering. They also feature social demographic factors that may impact the youth mental health, highlighting potential gaps and disparities. So I'll share, I believe Susan already shared them, but then I'll share them again in the chat. And another good data source that I want to mention is the older adult survey. So in addition to the annual youth survey, Fairfax County also conducts a community assessment survey for older adults every 3 years, I believe. And according to the most recent data, 11% of older residents in Fairfax County reported poor mental health. These rates were highest among Black and African American residents and Hispanic residents. And the best place to find all this information for Fairfax County, including the ones that I mentioned now, is actually the Healthy Community Strategic Plan Dashboard, which our team created and published a year ago. And the data dashboard provides comprehensive population health information for the county in one place, from the number of uninsured residents to the availability of psychiatric beds in the county and many others. So be sure to check it out. And the metrics, what success would like, it's really hard to define, but I would say, Fairfax County, if you compare Fairfax County's like physical and mental health rates, I mean, it looks really good compared to all the like national standards and state standards. However, though, I think the true success really comes from does everyone succeeds, and we close the gap. We might not be able to close all the gaps, but then we acknowledge and work towards the closing those gaps. I think that's how success would look like for everyone. I think
That's a great
including
answer.
everyone. Yeah.
That's a great answer. We talk about mental health for all. Important that it's not just the availability of treatment, but it's culturally specific treatment. It's treatment that people can afford. It's being able to have support when you need it, where you need it. And in Fairfax County, I call this the land of plenty, but it doesn't mean it's the land of perfect.
Right.
And we have the ability to keep pushing towards that. So that's a great point, Chloe. So there's a question about getting young people off of social media and off their phones to alleviate some of the loneliness that we've talked about. But let's talk some concrete actions. Baby steps, giant leaps. Let's focus on some small changes that might turn into something huge. For us, for instance, we have now support groups that are specific for different communities. So we have one that's led by two Black trained leaders, and it's specific for family members that are dealing with mental illness in their family. We have a peer support group for LGBTQ. We have young people, and we have our first faith-based support group. And so they're baby steps, but part of my biggest work for the next at least 2 years is on health equity. So that's the big step. And how can we take those baby steps and make them into impactful systemic change? And so that's some of our work. I know I'm going to ask Mo with this one as well. Small steps, baby steps, big steps.
Yeah, for sure. I think definitely a baby step that is also a big step that folks have touched on, again, is taking that leap with connection. So if you are an adult and you are around young people in any capacity, the biggest and smallest step you can take is trying to connect with them. And I know the answer that we don't want to hear the answer around, social media usage and just telling the kids to get off the phone. But I'm here to say that like digital media literacy is a skill that young people have. And it is important that we continue encouraging young people to hone in on the skills that they have. And I think at the top of the COVID-19 pandemic, we realized how big of a skill that actually was. And so instead of asking young people to turn away from these communities that they have found when we switched from primarily in person to virtual, what we can do, especially as adults working with young people, is to make the good faith effort to understand these communities, to understand how they're using technology, to understand how they're using social media, and incorporate that into how we can connect with people. One of my favorite activities that we do with our younger middle school students is my own emoji. We're just asking them to draw an emoji that they would like to find on the keyboard that represents themselves. That's not us asking, put your phone away, don't use your phone, but it's also encouraging young people to think more thoughtfully and critically about the technology that they're using, and sort of asking that question, well, what would it look like to see yourself represented in the technology that you were using? So that's my little aside about technology. I'm the oldest of 8, so I've been yelled at from all of my siblings about how I feel about technology, so I'm taking a couple lessons from them. But yeah, I think that small step for me is also that big step. And so having that opening connection, whether it's an icebreaker, instead of asking a student how they feel, how have you been taking care of yourself? What have you been interested in lately? Just taking that extra step to actually connect with them before we're asking them to do a thing. I think is my ask, especially as someone who was a young person in a lot of these same youth programming institutions. It's my biggest thing that I like to remember as now an older person in this work.
I love that. So another time for a deep breath. Recent events, adding to our disconnect, adding to, for us, we are seeing some more mental health challenges. How have these new possible triggers added to the increased community mental health needs? And what can we do? What are some other steps we can take? You know, we have the fires raging. We have, you know, luckily some peace in the Middle East, and we have events taking place here in our, you know, federally, politically. Trauma is a thing, and it can happen regardless of if you're impacted immediately. So what are we doing? Do we know, does anybody have any ideas about what they've seen, but also how we can help address it? I'll start. So for us, both nationally and locally, we have helplines. NAMI Northern Virginia has a helpline, and it's a warm line. It's not a crisis line, 988. And we definitely have had many more people in the past 3 weeks that are looking for support, are looking for a support group. Can I go if I don't have a serious mental illness? Absolutely. Many affiliates throughout the country have set up specific kind of pop-up support groups to deal with different issues. I know in California, our affiliates in California have done that, and it's been monumentally important to people who just need to process feelings. You know, we say that it's okay to not feel okay, and it's true. And so how do we, you know, we're constantly looking for ways to make sure that we can be reactive to the needs of our community. Has anyone else seen anything like that in the past 3 weeks, 2 months? Okay. If you have any in the chat, if you've seen anything, if you have ideas on how we can be more supportive of our community, and that includes the people that are volunteering for us, let us know. Susan, I'm going to start with you on one. We're going to say hi back to Susan again. Emotional and mental health of persons of color who are volunteers in traditionally white-led, mostly volunteer, sometimes aging nonprofit spaces. As leaders of organizations, of volunteers, what's our responsibility?
I believe our responsibility is the same with all about being aware of situations, aware of reactions, aware of fragility, and offering a doorway to walk through, whether it's, do you need a break? Take a walk around the block. Is this not a good match today? Then we can end it here, and you know, we'll talk about what happens in the future, but giving people not don't allow somebody to drown, to wallow, but to let them know that their feelings are real, the feelings happen, it's okay, and we don't want you to look at a volunteer experience as a place to suffer. It can be, let's take a break now, or maybe this isn't a good match. Sometimes the volunteer themselves has a false sense of importance. We communicate with volunteers by saying, you know, we're so grateful to have you here. You're so important to us. You're making a difference today. But if it's not going to work, I want to be able to let them out, to let them free, whether to find a new space here at my organization, or there are some other things that might work better for you. Um, Safer spaces. It's January. Take a break. We can revisit this in April or revisit this in the fall. All those things are possible, and just let them know that we want to work with you and to make you the most valuable volunteer of the day is one thing, but also to say if you need to walk away, it's okay. We know that not all volunteering matches are good forever. They may be good for these next few weeks, but maybe by the time summer rolls around, it's no longer a match. So always offering that opportunity for flexibility. As a volunteer manager, I'm proud to say this volunteering experience is horrible and I'm never coming back. Oh well, and I walk, but other times I stay a long time. So, but it is a more sensitive issue. It can bring up feelings of things I don't always understand, or I may look at it from a different point of view. But the question is, how are you feeling? What can I do to help you? And not assume it's going to be one category or another.
I think the assumption is such a important piece of what we do with volunteers. We might think they are experiencing something in some way, but that's based on our own preconceived notions. It's not based on that person.
Right.
So
And a volunteer isn't a volunteer is a volunteer. No.
Laura, you wanted to jump in on this?
I just wanted to offer that recognizing the climate this week and different emotional responses, I think it's also an invitation to remember what joins us together. Even things like eating lunch together. How are you doing? Would you like to go on a walk? I know pets can also be extremely stabilizing for family routines and kind of some of the simple moments of remembering we're human beings in the same human family. I don't mean to sound glib at all. Help us to put some of the maybe differences in some perspective. It doesn't mean to minimize the intensity of pain. That's not what I'm trying to do. But sometimes the things that join us are more than the things that divide us. Is my offering.
That's powerful. Thank you for that.
And I would like to just kind of add to that. I think, from the perspective, Susan was talking about what that volunteer is feeling, and the focus was kind of on the volunteer and that volunteer then needing to make a change because of the feelings that they're having, but also thinking too back to the organization. Why are they feeling that way? Is there something that we're doing as an organization that we need to do differently? So I think having the ability to be in those spaces of having those conversations with a volunteer like that and exploring their feelings a bit more to find out what we might be able to do differently that can impact them as well.
Great. Okay. I'm going to ask this to everybody. You knew it was coming. Greatest wish to achieve good community mental health. Blue sky it. Sky's the limit here. So for me, it would be mental health for all, equitable, not cost prohibitive, plenty of culturally responsive treatment. It would be parity between mental health and physical health insurance as well, and pay. Anybody else? I'm going to call on everybody. I'm going to go across my screen. Susan.
Oh no, I wrote the question. I'm not
I
going to
know.
answer it. Blue sky, I'm thinking about, and what I hear most about is the lack of providers, lack of wide variety of providers, equity, different, male, female, different persons of color, having access to an equitable, safe mental health provider.
Right. Laura? Nobody knows how my screen looks, so.
Being able to uphold and notice and acknowledge the gifts all around us of the people in our lives and in the world, even when we don't know what they are yet, and being able to live with that. And then I'll also say, as a background in play therapy, play and joyful moments of connection are restorative and healing. And so I wanted to offer that as well.
Thank you. Stacy?
Yes, and mine is more of that kind of picture as well of, and it brought me back to two words of really just permission, that of acceptance and acknowledgement, and that giving giving us all permission to not maybe always be at our best, and accepting when those around us may not be at their best. And then presence is another one, and I just think about listening more and talking less, and being bold and brave enough to really look others in the eye with genuine care and concern. And I'm going to go back to exactly what Chris said, because it was my words as well. How are you doing? And then stopping to really listen to that answer and not to try to fix it. So that's kind of how I think it's a baby step toward, if that were to happen, how that might impact and expand into a larger impact.
Great. Chloe.
Sorry. My greatest wish is fostering a culture of support and connection for everyone. And the keyword here is, again, everyone. So everyone who is of any race or ethnicity, of any gender, of any sexual orientations, and any socioeconomic status or cultural backgrounds. And as we discussed, at the surface level, things might look good. However, if you look closely, disparities and inequities persist. Certain groups are disproportionately affected by mental health challenges, and people of color, individuals from lower socioeconomic backgrounds, LGBTQ communities, and those with limited access to resources, they face unique barriers to mental health care. And our job as a community, we have to collaboratively and collectively create spaces where everyone feels heard, seen, and valued and appreciated, and everyone can form meaningful relationships with others, regardless of their background or identity. And that is my greatest wish for the community.
Great. And Mo.
Yeah, I think I have a similar wish as Chloe's. I think my wish is for us all to stay committed to reimagining what care looks like for all bodies, all people, all cultures, all backgrounds. And then I kind of have a second part of wish because I was really focused on this our community. And so I thought like our community as like people who are working in this industry and nonprofit or organization spaces. My wish is for burnout to no longer be normalized, for that to not be a thing, and for us to remember and hold very closely that we too need to get rest as we continue to do this good work.
Mo, that is incredibly great wish. It's a great wish, but it's also a good thought. It's good for us to remember as we start the new year is um, we're here because we're passionate, and we're here because we believe in community, in people, and change. But we can't do the work if we get burnt out. So we need to take care of each other and ourselves. That is true. Mojo said passion doesn't have to mean urgency. Woo! She's speaking to me there because I am not patient. I want to read some of these that came in just really quickly before I turn it back over to Susan. In terms of this greatest wish, working upstream to change forces that influence social indicators of mental health, access to resources, healthcare, job opportunities, are baselines. That's powerful. Universal healthcare and mental health care, access to holistic and chemical solutions that take the entire person into consideration. These are really powerful in terms of wishes, and we all have the ability to make these changes and to see how that is. And maybe it's alone in our work, but most likely it's partners. And I'm so grateful to have the opportunity today to work with this wonderful panel and to listen and learn. So thank you all, to Susan, to Laura, Stacy, Chloe, Mo. I'm so grateful for this opportunity, and I'm going to turn it back over to Susan.
So thank you so much. I'm going to throw out the true last question, and feel free to put this in the chat to share, what's your one word or your one sentence for those who have more than one word in their brain for these things? Just your takeaway from the conversation today. I'm most interested if you're feeling optimistic or pessimistic. And I can tell you, I'll share my one word verbally because I wrote it down, circled it in red, blue, and then with my Sharpie, because I've never thought of this before. Everyone can be a mental health provider. Mind blown. So feel free to keep putting that in the chat area. If any of our speakers, panelists would like to say them, you're welcome to, or just go ahead and put them in the chat area. Just make sure that you're sharing with everyone. I wanted to let people know, I said this was our kickoff to our Martin Luther King Jr. Week of Service. Saturday is our major program where we bring families together to work on projects contributing to the community. We call it Give Together. And I think we've been doing this for 15, 16 years. I forgot to check that fact, but it's been a while. It's this Saturday, holding it at the James Lee Community Center. If you are registered, I will see you there. Come find me. I'll be there working, doing stuff. But if you are not yet registered, please feel free to join us. It's supposed to be for family, kids, moms, dads, grandparents, everybody coming together. We have Girl Scout troops and Boy Scout troops. We have lots of different people. If you are not here in the Washington area, um, uh, you can go to the AmeriCorps site, AmeriCorps.gov, find volunteer opportunities. So there is a way to think about all we've learned today, but put it into action by Saturday. And then, of course, volunteering opportunities throughout the year through Volunteer Fairfax. If you're here in Northern Virginia, please use us to connect. If you have enjoyed this webinar and appreciate our ability to put this together and offer this for free, we do ask you to give us a high five, which is actually a $5 donation, and you can get it through the QR code. I'm going to move to the next slide, but I will come back to this. But we are asking for that. And then my final reminder my ask is that you complete our evaluation. I think somebody will put this in our chat area. And I always like to end with my Maya Angelou quote because it's good for every webinar, especially when you're reflecting on our actions. Do the best you can until you know better. And then when you know better, you do better. I want to thank the panelists who have just given their all. And I wrote to them earlier saying I didn't expect to choke up, to tear up. That was unexpected. And so thank you for that. I want to thank my colleagues, Mejean, Sahara, Tammy, Patricia, Tina, Jennifer, and I truly could not do this without you. So thank you again for joining us today. I'm going to stop sharing and I'm going to check what people were saying on the words. And yes, there is a link. Thank you, Sahara, for adding that. And thank you all. I will go back to, I promised I would do that and then I forgot. I'm going to go back to the high fives. There you go, for those who want to. If you have any questions, feel free to put them in the chat. I will follow up with some information. There's been a lot of requests for connections and contact information. I will send that to everybody who was here today. But thank you again for being here and making this happen. Good job, everyone. I can't applaud, the little emojis that you get from the regular Zoom. I am so used to using those. I've gone there many times today and it's like, yay, it's not as strong as with the emoji. But thank you again, and everybody stay warm, stay safe, and hopefully we'll see you at another Volunteer Fairfax webinar soon. And I am going to end this so we can stop the recording. So thanks again.